While cycling home from work, Clara Beaumont saw something that nearly stopped her heart. A 5-car chain reaction crash. Glass scattered everywhere. At least 8 people injured. The moment she parked her bicycle, a police officer nearby said, "Ma'am, please stay at a safe distance." But Clara was already pulling out her medical bag, those chaotic sounds all too familiar. In the next 30 minutes, everyone at the crash site would discover who Clara Beaumont truly was, because some people are ready to save lives even on their ride home. Welcome to Hidden Legends. Before we dive deeper into this powerful story, let us know in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Clara Beaumont was the ideal paramedic. At 35, she'd been with Chicago Emergency Medical Services for 3 years, her long blonde hair flowing in the wind after a shift. She was a professional, every shift executed flawlessly, her calm approach inspiring confidence in her colleagues. But Clara was different. Her equipment checks had a military precision, her emergency interventions rooted in far deeper knowledge. "How do you diagnose so quickly?" they'd ask. "Experience," she'd reply with a smile, never elaborating because that experience came from places she didn't share. At 20, Clara had joined the Navy. Becoming a Navy SEAL was nearly impossible. Only 1% could survive BUDS training. For 6 grueling months, Clara pushed beyond her physical and mental limits, her father's memory driving her forward. She started as a combat medic, then mastered advanced tactical medicine, underwater rescue, multiple trauma management, and field surgery. These became her expertise. For 14 years, she served worldwide, leading over 200 rescue operations, her father's voice echoing in every one, "Never leave anyone behind." Her biggest mission was in Somalia, where she saved 150 civilians trapped in a flood disaster during a relentless 36-hour operation. Exhausted but smiling, she pulled the last person to safety. By 2020, memories of that operation began to haunt her. Constant sounds of water, panic attacks, hypervigilance. Diagnosed with PTSD, she was discharged and transitioned to a civilian paramedic role. Same mission, different setting, but the shift wasn't seamless. Clara's SEAL training went beyond the basics. After BUDS, she completed Advanced Combat Medicine, the elite program that shaped her into a multi-purpose lifesaver. Combat medic, diver, paratrooper, you're a life-saving specialist, her instructor, Master Chief Victor Long, had said. The toughest training was in multiple casualty scenarios, mass casualties in war zones, minimal equipment, underwater rescues. Clara excelled, especially in tactical medicine field surgery, structural analysis, emergency response coordination. The question wasn't, how do you save a life? But how many lives can you save? Trauma triage and multi-patient coordination became her sharpest skills, perfectly suited for the chaos she'd face on the highway. Throughout 18 months of training, Clara never faltered. On graduation day, her family's pride shone, but she carried her father's photo close. That evening, after a normal shift ending at 6:30 p.m., Clara cycled home from the Chicago EMS station, her blonde hair catching the breeze. She organized the medical supplies in her bicycle bag, a routine end to a successful Friday. Traffic was heavy on Lakeshore Drive, but she rode safely on the side path, satisfied after a long day. Then she noticed it. Unusual radio chatter, multiple emergency units mobilizing, a subtle tension in the air. At Lakeshore Drive near Northside, she saw the horrific scene, a chain reaction crash involving a truck and 4 cars. Clara stopped, assessed 5 vehicles, 8 injured, 3 critical, glass and motor oil everywhere. "Ma'am, please stay back," said Officer Elias Thorne. But Clara was already unpacking her medical supplies, gear she'd carried for 14 years. "I'm a paramedic, Elias. I can help. Ambulance is 20 minutes out." She glanced at the injured. "We don't have 20 minutes. Her SEAL training kicked in, memories of Somalia flooding back with the same determination and composure. Clara approached the first victim, a truck driver in his 50s, struggling to breathe with chest trauma. "Sir, I'm Clara, a paramedic. I'm here to help," fear filled his eyes. "I can't breathe. Chest pain. Am I going to die?" Clara's assessment was swift. Chest wall asymmetry, possible rib fractures, risk of internal bleeding. No, you're not going to die. I'll fix your breathing. She evaluated further risk of tension pneumothorax, emergency intervention needed. From her bicycle bag, she pulled an advanced airway kit, equipment no standard paramedic would carry. Try to take deep breaths. I'm giving you oxygen, she said, establishing 4 access. How is this possible? You were cycling, Elias marveled. I'm always prepared, Clara replied. 10 minutes later, the driver's breathing stabilized, oxygen saturation improved. Elias was stunned. This is professional level intervention. How? The second victim was critical, a mother in her 30s, unconscious in the front seat. A child's voice tore at Clara's heart. Mom, don't sleep. SEAL training flashed back. Save children and mothers first. Hello, sweetheart. I'm Clara. I'm going to wake Mommy up, she called to the frightened 6-year-old in the back. Why is Mommy sleeping? She's just resting. I'll wake her. Clara assessed. Head trauma, possible concussion, weak but regular pulse. She pulled a cervical collar from her bag, another item not standard for paramedics. Risk of neck injury. I need to move her carefully, she murmured, using SEAL spinal immobilization techniques to set up an improvised stabilization system. 15 minutes later, the mother opened her eyes. My daughter, Sophie. Sophie's safe. You're safe too. The mother grasped Clara's hands. You're an angel. Where did you come from? Just passing by, Clara said softly. The third car held the most critical case. An elderly couple in their 70s. The man suffering a heart attack. The woman showing signs of internal bleeding. Chest pain, left arm numbness. The man gasped. Elise, help Elise. Clara checked the woman, abdominal rigidity, possible spleen injury, a dual emergency. SEAL training guided her. Save the most critical first, but lose neither. Elias, when's the ambulance? 10 minutes. Not enough. Clara pulled a cardiac medication kit from her bag, definitely not standard. Administering heart medication to the man, she monitored his wife's vitals simultaneously. These are prescription medicines, Elias noted. I'm a licensed paramedic. I have authorization, Clara said, though her real authority came from SEAL training. The fourth and fifth victims, 2 college-aged men with orthopedic injuries, were stable. Clara triaged quickly. I'll get to you, boys. I'm stabilizing the critical ones first. Okay, sis, you know best, they replied. Her triage was flawless, honed by 14 years of SEAL experience. Coordinating 8 victims at once, Clara outpaced Elias's attempts to assist. Which patient first, he asked. Heart patient, then internal bleeding, then chest trauma. She answered automatically, her SEAL multi-casualty training in full effect. When ambulances arrived, the paramedic team was shocked. Who performed these interventions? I did, Clara said calmly. Who are you? Elias answered, a cycling citizen, says she's a paramedic. Paramedic Chief Luca Rossi studied her. Which service? I don't know you at Chicago EMS with this equipment. Clara hesitated, then revealed the truth. 14 years Navy SEALs. Combat medic, now civilian paramedic. Silence fell. Naval Special Warfare Command, Luca said in awe. That explains it. Elias shook his head. We thought you were just a cyclist. I am, Clara said, but also an elite military medic. Luca nodded. Textbook perfect. At Chicago Medical Center, all 8 patients were under treatment. Clara checked on each. Theo, the truck driver, recovered from chest surgery. Marie, the young mother, was stable. Henri and Elise, the elderly couple, survived their heart attacks. Nurse Clara, little Sophie, said from her hospital room, You saved Mommy. You're a superhero. Clara sat beside her. No, sweetheart, I just did my job. Real heroes are strong like your mom. When I grow up, I want to be like you. Then work hard, but first, watch Mommy get better. Dr. Alessandro Conti, head of emergency services, met with Clara. Without you, we'd have lost at least 3 people. This is combat medicine level. Just my training, Clara said. What training? This isn't even taught in medical school. She told the truth. 14 years Navy SEALs combat medicine. Dr. Conti was floored. You're an elite warrior. Word reached Clara's former SEAL teammates. Master Chief Victor Longa messaged, Saw you on the news. Still saving lives. Still a badass. The most touching came from Olivier. father of a boy Clara saved in Somalia. My son never forgot you. He's a doctor now, wants to save lives like you. Thank you for giving me my boy back. That evening, 63 messages flooded Clara's phone, teammates, commanders, even Pentagon contacts, all saying, once a SEAL, always a SEAL. Clara's story isn't just about heroism. It's about the evolution of service. From Navy SEAL to civilian paramedic, combat medicine to street EMS, tactical response to compassionate care, she's always serving. The military taught her to save lives, EMS taught her to heal, the community showed both are vital. Survivors say of Clara, real warriors don't stop fighting, they find new battles worth fighting. Her courage that day was SEAL training applied to civilian emergencies. I'm no longer a warrior, Clara says, but the service spirit never ends, the mission changes. Clara Beaumont still works at Chicago EMS, still cycles the same routes, but now her colleagues know the story behind her bag's equipment. Recently, Nadia asked, Clara, do you regret leaving your military career? Parking her bicycle, Clara replied, for 14 years, I protected the world as a SEAL. Now I protect Chicago. Same mission, different uniform. That evening, she passed Lakeshore Drive near North Side, where families had left flowers. Clara stopped, paid her respects, and checked her bag, advanced medical gear, still ready for the next emergency. Because real heroes change uniforms, but their missions never end. So, have you ever met someone like this, ordinary on the surface, with extraordinary skills? Warriors with hidden elite backgrounds who rise in critical moments? Share your stories in the comments. At Hidden Legends, we believe the greatest heroes are often found in the most ordinary places. If this story moved you, share it, subscribe, and help these veteran stories continue. See you in the next legend. And remember, the next cyclist you see might be far more extraordinary than they appear. Real heroes pedal quietly through life, ready to save lives when destiny calls.